So this is the video on how to set up your goniometer and also how you would take the measurements at the ankle for plantar flexion, dorsiflexion, inversion, and eversion. So to begin, this is your goniometer. The central disc is this circular part in the middle. The proximal arm is what connects to the disc, and this is typically placed along the non-moving joint. And then you have your distal arm, which is what we use to take the measurement. So you have your central disc, your proximal arm, which is connected to the central disc, and your distal arm, which we move to measure the degree of the angles, and this is going to be your focal point. So again, before we take our reading, we will set up the central disc or the central part of our reading along the circle with a joint line, and then the proximal arm is going to go along the stable joint or non-moving joint, and then we would take our reading using the distal arm once we have asked the athlete to complete a certain movement. When measuring dorsiflexion and plantar flexion of the ankle, you want the athlete to be seated with the leg hanging off of the table, so whether a chair or a table of some sort. The focal point is going to go over the lateral malleolus, and your proximal arm, which is the non-moving arm that is connected to the disc, is going to point towards the distal fibula. And then you're going to you can hold this just to hold it in place. And anytime you start, you're going to start at a 90, 180, anything is going to be 0. So once you take a measurement, you're not going to add 100 or 90 degrees. You're just going to measure from that point of 90 or 180 to wherever the athlete has finished their range of motion. So point your foot all the way up to your shin. So here we would take our reading, and you want to make sure when you're reading that you have the distal arm in line with the fifth metatarsal. So you want it to be parallel, so not perpendicular or not anything other than parallel. So the fifth metatarsal, you want to make sure that it's parallel. And so for here, now they're parallel. It has about 10 degrees for dorsiflexion. Normal degrees for dorsiflexion is around 20. And then point your foot all the way down to the ground as far as you can. And again, we are going to take our reading, and you want it to be parallel with the fifth metatarsal. And here he has about 37 degrees. And normal range of motion for plantar flexion is going to be anywhere between 30 to 50 degrees. To measure eversion and inversion of the ankle, you want your focal point in between the malleoli, so in between the medial and lateral malleoli. You also want your proximal arm towards the tibial tuberosities, so the midline of the anterior leg, and then you want the distal arm midline towards the bone of the heel. So for inversion, you would just have them, so if you would point your foot all the way towards the inside of the body as far as you can go, and so you would take that measurement as well. And then the same with eversion, all the way out as far as you could go, with keeping your knee straight all the way out, and then you would take that reading as well. The typical range of motion for inversion is about 20 degrees, and then the typical range of motion for eversion is about 10.